All right, good afternoon and good morning to everybody who's joining us today. It's the top of the hour, so we're going to get started. Welcome to today's webinar, and we're going to talk about climate and health, best practices for effective communication. We're going to dive right in as we've got a lot to cover during this hour, and we want to make sure we leave time for questions at the end. This is Meg Sansevero with Marketing for Change speaking, and first I just want to cover a couple of housekeeping items with all of you. So first, all participants joining here, you should be on mute by default, but as a courtesy to us and everybody else joining, please make sure that your mic icon is on mute while you're listening. And second, if you have any questions for our presenter today, please make sure that you type those into the Q&A box. So not the chat box on the right side of your screen, but the Q&A box that you should see a link to on the bottom of your screen. That's how we'll get the questions to answer at the end. This webinar is being recorded, and anybody who registered and participated live today will get a link to that recording, which will be made available after today. Next slide. So we're really excited today that this is the first of 6 webinars scheduled for this year as part of our first ever Amplify series. This series is designed to help health officials increase their capacity to effectively communicate the public health impacts of climate change and help their communities prepare and respond. It's led by the behavior change communication experts at Marketing for Change, and we're very grateful it's supported through a cooperative agreement with the Centers for Disease and Prevention. And we just want to really say thank you to CDC for making this exciting learning opportunity available this year to all the grantees as part of the Climate Ready States and Cities initiative. We could just bump back to the previous slide.
Sorry.
Get started, no problem. Thank you. Just a quick disclaimer that the contents of this slide presentation are solely the responsibility of the authors and do not necessarily represent the official views of the CDC. All right, and today's speaker is Dr. Ed Maybach. Dr. Maybach is a professor at George Mason University's Center for Climate Change Communication. He's an expert in the uses of strategic communication to address climate change and related public health challenges. And we're really lucky to have Ed here with us today and to share his learnings to date. Please do take advantage of the opportunity to ask him questions at the end. Without further ado, I'll let you take over, Ed.
Thank you, Meg, and good morning, good afternoon, everybody. Thanks for joining us today. I'm going to try to use your time well, try to be as brief as possible to share a few ideas with you. I'd like to maximize the opportunity to actually engage with you, so we're going to be a lot of time, hopefully, for Q&A at the back end of the hour. I have essentially 4 major points I want to make. I want to provide you a little bit of background on what we know about public understanding of climate change and health. Like to provide some thoughts about what I consider to be an evidence-based guiding heuristic for communicating important public health information. In the case, and I'll customize it and make it relevant to climate and health today, but it's really a more general guiding, evidence-based guiding heuristic for effective communication. Provide a little bit of message guidance, or at least share the message guidance that CDC has developed and is encouraging you all to use. Then I'll introduce you to some highly local data and message tailoring information, both communication materials that you can use as well as resources that you can use to better understand people in your community with regard to how they think, feel, and are acting or would like to see us collectively act through policy to address climate change. And then really the conclusion is simply just a chance to interact with you all and hear your thoughts and answer your questions. So with regard to public understanding about climate change and health, what I want to say is we actually just released a poll earlier this week. We did not have time to change the slides to reflect the most current poll data. I'm happy to say the public is changing in their views about climate change. They're developing a more reality-based understanding of climate change. But what I'm about to share with you is really a much more in-depth study that we conducted about 4 years ago, actually, to really look at fundamentally, what do Americans know about the relevance of climate change to our health? Sort of the good news, even back then in 2014 when we did this study, is that most Americans understood that the climate is changing. It really wasn't then, and certainly is not now, the contested issue that we are often led to believe in the media. Most Americans do understand that it's happening. However, they saw it at that time in 2014, and to a great degree, they still see it as a distant threat. People see it as distant in time. So we tend to think of climate change as something that will affect our lives or whoever is around on the year at the year 2100's lives. So we don't see it as a 2019 problem, but more a 2100 problem. In part, that's because when we hear about the results of climate science, we often hear projections about what is to happen in the future, often the distant future. An inadvertent consequence of that, and I would suggest an unhelpful consequence of that, is that most Americans, as I've said, do tend to see it as a threat that is distant in time. It has not come home to roost in our communities yet. Americans also see it as distant in space. Maybe Bangladesh, a country that probably most Americans couldn't find on the map, but not Boston, not their community. And one of the, probably the most important finding, the most important top-line finding from the National Climate Assessment, which was released last November, was in fact that no, climate change actually has come home to roost in communities across America today. So the National Climate Assessment makes clear that climate change is a here and now problem. And it also makes clear that it's not just a plants, penguins, and polar bears problem, but that is fundamentally the way that most Americans see it. They see the polar bear as the iconic species that is being harmed by climate change, and they don't so much see us, people, in that picture. We like to say that all three of these ways of misperceiving climate change create a psychological distance between us and the issue, which tends to give us the latitude, if you will, for not thinking about it today, not worrying about it today, but in fact, assuming, I would say incorrectly assuming that we have plenty of time to deal with the issue later. So this is simply another way of representing the idea, the data that I've just walked you through. We ask people the question, how much do you think global warming will harm? And then we finish that sentence by posing a variety of different individuals and groups of people and non-peoples at the very right end of the slide. And this was data from the survey that we released in March 2018. So this is about 8 months old now, but you can see that earlier last year, essentially 4 out of 10 Americans felt that they personally would be harmed by climate change, and slightly more than 1 out of 10 felt they personally would be harmed a great deal. As you move across that slide from left to right, from a person themselves to their family members, people in their community, other Americans, people in developing countries, the world's poor, future generations of people, and other plants and animal species. You can see a really clear pattern that most of us are convinced that harm will be done or is already being done, but again, we see it as distant from us. All of you know that it's nonsensical to talk about the public as a single totality. There really is no such thing as the public, but there are many different publics out there in every one of our communities. In our research, since we focus exclusively on the issue of climate change, global warming, we have done an audience segmentation analysis to identify the different ways that Americans think about global warming, how that relates to how they feel about it, what, if anything, they are personally doing, and what, if anything, they would like to see us as a community or as a nation do about it. These were the prevalence. So we call this global warming 6 America. This was the prevalence of the 6 Americas, again, in spring of 2018. It has actually changed. Most recently, I saw the data for the first time today from our most recent survey. I'm happy to report that there are significantly more members of the alarm segment than there were now than there were only 8 months ago. Something very helpful is happening out there in America with regard to public understanding and acceptance of global warming. Unfortunately, one of those factors is likely that more and more Americans are being personally harmed by global warming, or having their family members harmed, or witnessing other members of other fellow countrymen and women being harmed. For example, when we all saw the town of Paradise, California, literally burned off the face of the map last fall. Coming back to the point, it's helpful to understand how different groups of America think about the issue. Really won't spend a lot of time talking about, sort of introducing you to each of these 6 Americas, but I do want to make a couple of points about the distribution. So the first point I want to make about the distribution is you'll notice that it is perceptibly loaded on the left side of the distribution. There are far more Americans who are alarmed and concerned about climate change than there are Americans who are doubtful or dismissive about climate change. So this notion that there are 2 Americas, those who are convinced and worried and those who are dismissive, it really isn't so. The dismissive segment over on the extreme right-hand side, they are fewer than 1 out of 10 Americans. Yes, I'm going to anticipate the question you will be asking. Yes, there are differences. These distributions differ from community to community. In deep red states, there will be more people on the right side. The continuum will shift slightly to the right. In deep blue states or deep blue communities, the continuum shifts perceptibly to the left. But in your community, in every community across America, and we know this because we've looked, the 6 Americas are there. And by and large, the distribution is stacked towards Americans who are alarmed, concerned, and alarmed and concerned about this problem. It's a really important point to make, because for those of us who are worried that when we do our job and educate the public about the health implications of climate change, it's reasonable for us to worry that we may end up generating some blowback. But what I want you to understand is that most members of your community will appreciate this information. And based on the data I'm about to show you, very few members of your community will have heard the information that you can share with them. So back in 2015, using the data from our fall 2014 study, we really looked deeply at this question of what do Americans know about the implications of global warming for our health? And the very first question we ask people about global warming as health is, do you think global warming is bad or good for the health of Americans? It's a very broad question. And what you can see is that there's a lot of difference among the 6 Americas in terms of those who tell us that they see global warming as bad for our health, the health of Americans. What I'd like you to do when you look at this data is pretty much discount anything that isn't a relatively robust color of blue. So the darkest blue represents people who say it's very bad, -3. I guess more royal blue color represents people who gave it a score of -2. So just a tad under very bad. You can see that most of the alarmed, almost all of them, said it was very bad or almost very bad. But you get a fairly steep drop off as you go across the 6 Americas continuum from there. The reason why I personally discount this as being meaningful information, I don't discount it entirely, but I discount it a little bit because of a very well-known fact that when you ask people a question that they don't know the answer to, they will, generally speaking, substitute the question for a question they do know the answer to, and they will give you that answer. So when I see that essentially nine out of 10 members of the alarm segment say they think it's global warming is bad for the health of Americans, I think what they're actually telling me is they think that global warming is bad, and therefore they're answering this question. They're substituting because they really, as I'm about to show you in a moment, they really don't know very much about the ways in which it's bad for Americans. So they're just answering a different question that they're fundamentally much more confident of and much more convinced about. We follow up that question by asking people, well, before taking this survey, how much, if at all, had you thought about how global warming might affect people's health? And again, I would encourage you just to look at the darkest blue wedge or bar and the royal blue bar above it. You can see that most members of the alarmed told us, yeah, I thought about this a lot or a moderate amount. But once you move over to the concerned segment, you can see that it drops down to only about 4 out of 10 and only about 2 out of 10 members of the cautious. The net here is that most Americans, at least in the fall of 2014, were telling us they really hadn't given the issue a lot of thought. We followed that question by asking them, in your view and in your own words, because this was an open-ended question, what health problems are Americans experiencing from global warming, if any? Now, this is a hard question because this is not a question that people can take their general belief about global warming and substitute a specific answer to, because this is asking a very specific question. And I'm sorry that the slide is probably, the figure is probably a little bit small on the slide, but I'll just take you through my interpretation of what you see there. The dark blue bar are the proportion of people in each of the segments who gave us at least one, who accurately named at least one health problem that Americans are experiencing as a result of climate change. And you can see that six out of 10 members of the alarm segment could name at least one health problem, 3 out of 10 members of the concern segment, 2 out of 10 members of the cautious segment, and essentially 1 out of 10 for the remaining segments. And then we coded the open-ended answers that they gave us, and that is the data displayed on the right-hand side of this slide. The takeaway is that most people who could name a single way in which the health of Americans are being affected by global warming, most people said they gave an answer essentially consistent with it's affecting us through our lungs, whether that's asthma, COPD, or other respiratory problems. So that is, in terms of understanding the mental model of Americans with regard to the issue of how does climate change influence our health, to the extent that there is anything out there in the mental models of Americans, it's really the fact that it's affecting the health of our lungs, our respiratory health, if you will. And it's mostly that knowledge, that mental model is mostly constrained to the alarm segment. And then a question of great concern and interest to us in public health is, well, do you know who is most likely to have their health harmed? So we asked the question, which types of Americans do you think are more likely than others to experience health problems related to global warming? And as you can see, relatively few Americans were able to answer that question at all. And most of those who chose to gamely try gave right answers. A small proportion gave incorrect responses. But even among the alarm segment, it was only half, and about a third of the concern segment, and then virtually non-existent among members of the other 4 segments. So relatively vague awareness that climate change is harming our health, but little specific knowledge about whose health is most likely to be affected or in what ways their health is most likely to be affected. So that is essentially our educational opportunity, our communication opportunity, if you will. We can answer those questions, and I would suggest we really have an obligation to answer those questions, because as public health professionals, we understand all too well, as was discussed very nicely in the National Climate Assessment, that in fact climate change is harming the health of Americans already in a variety of different ways. I'll get more to specific messaging that CDC is recommending in a moment, but before I do, I just want to introduce this notion that I call it a heuristic for spreading important ideas about human health and well-being. And the reason it's a little weird and out of context in this presentation, but the reason I represent it with a rocket, a NASA rocket over there on the left hand, is because this heuristic is a way that you can use to give lift to important information, to make sure that important information gets out of your office, out of your head, out of your office, out of your health department, and into the lives of people in your community. And the important heuristic that I want you to think about is essentially every public health campaign that has ever succeeded, I would contend, has succeeded because it used simple, clear messages. It succeeded in having those messages repeated often. And those messages were brought to members of the target audience by a variety of trusted voices whom they trust, whom the members of the target audience trust. So I'm going to break this down into the three components and tell you a little bit more. But the reason why I call this an evidence-based heuristic is because this is only 11 words. Between those three recommendations, 11 small words, but there is a ton of social science that supports why this is so, why this is a reliable approach to sharing important ideas or important information that we know to be true based on epidemiology and other public health methods. So simple, clear messages. Why? The topics that we often want to communicate about are not simple. There really is very little simple about the ways in which climate change is harming our health. But we have no choice but to simplify what we know, because the less we say, the more we're heard. And the simpler we say it, the more likely members of our audience are to understand it. So we can strive to communicate complexity, but the more we buy into the fallacy that because it's complex, we have to communicate it about it and communicate in all of its complexity, that really is the exact wrong thing to do. So the corollary to the less we say, the more we're heard, is that we need to say the things that have the most value to our audience. We know a lot about the ways in which climate change is harming the health of Americans. But it behooves us, it is very much in our best interest to figure out what parts of that members of our community already know, because we don't necessarily want to tell them what they already know. We want to make sure we use our limited communication opportunities to give them the information that's going to have the most value to them in understanding the risk and in understanding what they can do about it, because that's ultimately what effective communication looks like. And sort of the corollary to that is audience research is our greatest asset in terms of determining what information is going to have the most value to our target audience. We can't, as experts, look into our own hearts and our own minds and say, well, that's the thing that's going to be most valuable. That's a perfectly good starting point for forming a hypothesis. But ultimately, we have to make the effort to engage with members of our audience to find out what facts that we know and that we know to be true will have most value to them, members of our audience. So why can't we just say it once? Why do we have to say it often? Because that's the way the human brain works. Aristotle taught us 2,500 years ago that repetition is the mother of learning. Social scientists over the past 50 years have also taught us that repetition is also the mother of liking and the mother of trust. The more we hear things, not only the more we come to learn them, but actually the more we come to accept the information, and the more we come to trust the information. And it all comes down to this notion that neurons that fire together, wire together. So every time we hear new information, or every time we provide new information, we are reinforcing a neural network in people's brains. And the more we strengthen those neural connections between the ideas that are already resonant in people's brains, but suggesting novel connections between, in this case, what people know about global warming and what they know about their health, the more we strengthen it through repetition, the more they will come to learn it, like it, and trust the information. We don't always have to say it in the same way. We can adapt it, we can elaborate on it, but most importantly, we got to deliver our message as frequently as we can, because that is how we ultimately end up reshaping people's mental models, their understanding of the issues that we're trying to enlighten them about in ways that are consistent with the information we're trying to share. And then finally, we don't have to do it all with our words. We can use visuals to reinforce the words. We can use metaphors, verbal images, analogies to reinforce our words. All of these things are ways in which essentially we can accentuate what we're trying to share only in words. So I don't often cite Frank Luntz because I find I am often not supportive of what Frank Luntz is trying to do in our society. But I have to say, Frank Luntz, a political strategist, is quite brilliant and insightful about human understanding and human communication. And this comes straight out of his book. And he says there's a simple rule. You say it again and say it again and say it again and say it again and say it again. I won't read them all times, but he concludes by saying, and about the time you are absolutely sick of saying it is about the time that your target audience has heard it for the first time. That is so true. So if you feel you have said it, but you haven't felt you have said it so many times that you're absolutely sick of saying it, your audience hasn't yet heard you. Finally, trusted sources. The importance of trusted sources is because where there is no trust, there is no successful exchange of information. It might not be us. We might not be the most trusted sources. Fortunately, public health professionals, we are among the most trusted members of any community. So I would actually suggest that we are trusted, but we are certainly not the only trusted members of a given community. And we might not even be the most trusted because most people in a community don't know us by name. Many people don't even necessarily know us by profession. If we were pediatricians, they would totally understand what we do. We are public health professionals. We all know they've got a relatively hazy understanding of what we do. But we are trusted, and trust is so important in accepting information that is offered up for consideration. When we feel that there are other more trusted people in our community, we want to we want to bring them on as our partners in sharing this information. Lots of well-intended members of every community in America are highly motivated to share what they know about how they and their fellow citizens can live more healthfully. So it is not difficult for us to enroll allies in our effort to share important information. But the point I want to make is the better job we do of developing simple, clear messages, the easier it will be for those other trusted voices in our community to share our messages with members of their social network. And ideally, success in communication happens when members of our target audience are the ones who are sharing our messages with their friends, family members, and coworkers, because the most trusted people in everyone's lives are their friends, their family members, and their closest colleagues. So really, that is the objective of a successful public health communication campaign, when our target audience members become the messengers, and the extent to which we offer up simple, clear messages that have value to members of our target audience, the more able they will be to play that role with us. So next, I'd like to just point you to actually something you may well have seen from the climate and health folks at CDC, but they've worked with us. They've worked with all of the experts who are studying what the public knows about climate and health. And they've offered up essentially a triptych, a tripology of messaging that they feel is really sort of hits all of the major points that they would like you to hit in your community. And it's pretty darn simple. Climate change is harming our health now in communities across the nation and in our community. And whatever you know about the ways in which climate change is already harming the health of people in your community, that is how you support that message. You give people the information about increasing prevalence of heat-related illness or vector-borne diseases, or increasing incidence of foodborne, waterborne, or foodborne outbreaks. Secondly is the fact that while all of us are at risk of having our health harmed by climate change, some of us in this community face heightened risk. That's our children, our student athletes, pregnant women, the elderly, people who already suffer chronic illnesses and allergies, and the poorest in our community. Those are the people in our community who are most likely to have their health harmed by climate change. But the sort of the final message is really the most important message, and that is there are actions we can take right now, both to prepare for these impacts and to prevent people in our community from being harmed by these impacts. And the sooner we get on with the business of implementing those actions, both as a community and as individual families, the more we'll be able to safeguard our health. And ultimately, the more we'll be strengthening our community and building in resilience to all kinds of health harms that none of us want to see more of in the future. I can tell you from my own personal experience that people across the Six Americas continuum will respond well to this information. Even members of the dismissive segment who don't believe that global warming is real, they actually see value in this kind of messaging because they do believe that we're experiencing that extreme heat events, for example, cause harm. And so the better the more capable we are in our community of planning how to deal with those extreme heat events so that our children don't get hurt, the better off we all are. These are simple, clear messages that will be of value to people across the Six Americas continuum in your community. So let me just conclude by offering up a couple of resources for you. These are resources that are localized, and I think will be of real value to you in starting a conversation about how climate change is harming influencing the health of people in your community. The first set of resources comes from a program that I developed over the past 8 years with my colleagues at Climate Central, and NOAA and NASA and the American Meteorological Society. The program was actually created to help TV weathercasters educate their viewers about how weather is changing in their community, bringing climate change home so that Americans understand that climate change is happening here now to us in our community. But we've worked pretty hard over the past 5 years since we've scaled this up as a nationwide program. We've worked hard to find data that is customizable at the local community level. So if you come to our media library, our Climate Matters media library, and I'll tell you how to do that in a moment, you will actually find story packages like these three. Story package on mosquito disease danger days. How many days in our community are people now at risk of being infected by a mosquito-borne disease? And in most communities in America, the number is going up. Story package on heat streaks and summer sports. What is happening during our summers, and what kind of risk does that cause to our student athletes and other people who are outdoors on those summer days? So this is an example of the kind of graphical information that we produce. As I've said, it's entirely localized. So this happens to be the increase in disease danger days in Birmingham. You can see between 1970 and 2017, there's 17 more disease danger days in Birmingham. There's a lot of difference from community to community, but generally speaking, that the trend line is up in every community in America. So if you would be so kind right now to take out your smartphone and take a picture of this slide, This is how you can subscribe to receive these free localized materials from our Climate Matters program. You either text the words Climate Matters to 345-345, or you go to medialibrary.climatecentral.org. We'll ask you a couple of questions, including your email address, because this is how we deliver the materials to you every week. Trust me, we are not intrusive. You can disenroll at any time, but I suspect none of you will. We find that people really, really like having access to these materials, and I'm confident you will too. So if you keep your phone out and take a picture of this slide too, please. My dear friends and colleagues at the Yale Program on Climate Change Communication have taken our national polling data that we can collect with them every 6 months, and they have developed a statistical algorithm that allows them to downscale that data all the way to the county level. So these Yale climate opinion maps, the most recent data of which is from 2018, are downscaled to your metro area, to your county. And they will teach you, they will show you exactly what members of your jurisdiction think, feel, and would like to see done about climate change. This is incredibly useful information to help you profile members of your community and learn to sort of titrate the messages that you are offering about climate and health based on what they already know. I would not represent these as the final word in your audience research, but they are a huge leg up. So in this case, you can see the map. This map of Alabama is the map of the degree to which people understand that global warming is affecting their weather. And this map represents the proportion who believe that global warming is harming them, will harm them personally. There's one other place I would like you to get information. I don't have a slide of it, but it happens to be the website of my center, climatechangecommunication.org, or just remember George Mason University Center for Climate Change Communication. And on my homepage right now, right there in the top of the fold, if you will see a report under our most recent reports called Medical Alert. It's a report that we developed on behalf of the Medical Society Consortium on Climate and Health. And in that very brief report, we have tested messages about the impacts of climate and health and solutions that we know work because we've conducted research, and we've actually published a study in GeoHealth last year showing that these are highly beneficial messages in helping Americans understand the threat and understand the opportunities for response. So I guess I just want to conclude on the incredible things that CDC, the Program on Climate and Health, is already helping you all do. Whether you are actually funded in the Climate Ready States and Cities Initiative, I hope you all are. If you are not, I hope there's an opportunity for you to receive that funding in the not too distant future. Their program has developed the BRACE framework, and they have all kinds of other wonderful resources for you to use. You are all probably much more expert in them than I, but I felt like I wanted to bring them up in this context. So in conclusion, I cannot, as a career public health professional, I cannot tell you how appreciative I am of all you are doing. You are doing the most important work that I think can be done. I hope that our work proves to be of some value to you in that important work you are doing. So why don't we just open up to your questions, because I'm really eager to hear what you all think, and maybe you all have important recommendations to share with each other that are better than the insights I have offered up for you.
Great. Thanks so much, Ed. This is Meg again. So it looks like we have a number of questions in the Q&A, and we will go to the top of the hour at 2 p.m. Eastern, as long as there are enough questions. So go ahead and continue typing those in as we're going to answer them. And I'm just going to start with the first, which is great. So Sarah is asking, can we get the slides? Where can we get the CDC's messaging? So yeah, that's great. So again, this is being recorded. Everybody who registered and is attending today will get access to that recording where you'll also see these slides, as well as you have access to public communication tools that CDC has made available at cdc.gov/climate and health. We will type that URL, one of my colleagues, into the chat box as well. If you didn't get all of that, and if you look under resources, you can see some of the latest communication materials that they have made available. And I know Ed may have some resources as well. Great. Okay. And Jessica asks, are there simple and clear messages about what a person can do to take action against climate change on an individual level?
Yeah,
Yeah,
so Jessica,
great question.
fantastic question. The unfortunate answer is yes, there are, but they're all over the place. And I'm actually going to respond to your question specifically with regard to take action against climate change to protect ourselves and our family members from the health consequences of climate change. We actually did a study last year in which we asked members of the public what they think is the most important actions they can take to protect their health, and what's the most important action they think their community can take to protect members of the community's health from the health harms of climate change. And when because we were fairly sure that most people would not have an answer, once we collected that data and coded it, we realized we don't have that answer either. So we are right now starting a study where we're polling climate and health experts, and we're asking them to rate essentially all of the behavioral recommendations that we learned about through a variety of different methods, not the least of which is through the ones people suggested to us in our survey. I am hoping that that can become an impetus for us developing a set of recommended individual level actions that protect health from climate change, but it doesn't exist yet. So maybe Meg knows of what she would consider to be the most helpful set of recommendations, or maybe somebody else on this conversation does, but I myself don't yet have it.
Thanks, Ed. Yeah, it's great timing for that question. I know you are in the middle of conducting that research too. Yeah, I don't know if I have anything great to add there. But again, there is perhaps, other than the great work that the BRACE grantees have been doing on the ground over the past few years, and what they have found in their settings and locally, to be the most simple and clear messages around actions. So yeah, I would say the work they're doing as well as what you're doing. And Ed, where can folks stay up to date on that information? Like, as you're doing that research and you're releasing those results, how can folks make sure they are getting access to that?
Oh, thanks, Meg, for queuing me up to answer that. But when you come to my website, climatechangecommunication.org, on the homepage, you will see a subscribe button that's essentially will just subscribe you to our research, which we pump out our research reports first and as fast as we humanly can, right to the people who we think can use the information. And then we get around to the business of publishing it in academic journals. So, we feel the public health mandate to respond to this is so overwhelming that we don't slow down the dissemination of our findings through the peer-reviewed literature. We do get all of our work peer-reviewed eventually, but so come to our website, sign up, hit the subscribe button, enter your email address, and as we develop it, it will go right into your inbox.
Great, thanks, Ed. Okay, next question. This is from Michael. So, political connotations aside, how should we frame messaging when confronted with, quote, fake news, unquote, as it pertains to climate change and health? Should we stick to our consistent messaging or debunk misinformation, or both?
That's a great question. When you come to my website, you can actually find something that my colleague John Cook took the lead in developing. It's called the Debunking Handbook. It's a simple, clear set of guidelines about what the evidence-based tells us about how to most effectively debunk misinformation. But let me give you sort of the top line recommendation, because I know that most of you probably don't have time. And so the way Michael set up this question, I think, is really nice. He said, do we stick to our guns and continue to communicate what we came to communicate, or do we debunk the information, or both? I would suggest, when you don't have time to debunk misinformation, just stick to your guns. Communicate the information you came to communicate. And when people essentially raise misinformation, essentially just say, well, that's not actually true. But what is true is, and you go right back to the information you came to share. There is a downside to repeating misinformation. And the downside is sort of a corollary of what I mentioned earlier. By repeating that information, that misinformation, people become more likely to remember it. And you're simply reinforcing that neural pathway. So generally speaking, it's helpful not to repeat misinformation.
Great. Thank you. Thanks for that question, Michael. I suspect it's one that many of us have had. Okay. Let's see. Laura, she says, I like how the Climate Matters materials are localized, but I'm concerned that the graphs are hard for the layperson to interpret. Do you have survey results on the effectiveness of these graphs with different audiences?
It's a great question. And yes, we've put a lot of resources into developing these graphs, and therefore we've put at least some resources into evaluating their impact. We know that from the very first pilot test of these, using this information in a community, that community was Columbia, South Carolina. Our one weathercaster on the CBS affiliate in Columbia, that's WLTX, he's their chief meteorologist named Jim Gandy. He essentially he aired 13 stories over the span of 12 months using graphics that were the forerunner to these graphics, but they were very much like these. And we did pre and post surveys over the course of a year in which we compared how his viewers' understanding of climate change as a local issue in Columbia changed over the course of that 12 months as compared to the viewers of competing stations. And what we found, so it wasn't just using the materials, but it was activating Jim Gandy's trusted voice as a climate educator. So it was the combination of these graphics and what he would say about how he would help audience members interpret these graphics. But what we found is that over that in that pilot test, we actually had a pretty unexpectedly large impact in terms of helping the WLTX viewers understand climate change as a here now problem in Columbia. We've done other evaluations of use of these graphics. We're currently trying to finalize a national impact evaluation. That isn't yet finished. It turns out to be quite a heavy lift, but in all of the controlled studies where we've used these graphics as explained by a trusted messenger, we find that people don't actually have a difficult time understanding them. They take away the key message that things are changing in my community, and not necessarily in a way that's good for me and my family.
That cues up our next question perfectly, which is from Antonia. Who are found to be the most trusted messengers?
Yeah, so great question. In long-standing polls that have been conducted nationwide and in actually many nations over many, many years, right now, America in 2019, the most trusted messengers are, the most trusted institution in America is the military. So military leaders are highly trusted messengers. You won't hear them saying a lot about climate change, and you certainly won't hear them talking about climate change and health. But the good news is that the next tier of most trusted messengers are health professionals, doctors, nurses, pharmacists. We don't ask about, the polls don't ask about public health professionals, but that's just because the public has a relatively fuzzy notion of what public health professionals, who they are and what they do. But you make sure that people know who you are and what you do, and they will trust you. So when I'm suggesting to you that you educate members of your community about the health relevance of climate change, I do so for two reasons. for three reasons. One is because they don't know much about it right now. Two is because they find great value in it when we do make the effort to educate them. And three, because you are trusted messengers. Even if they don't know you personally, when you introduce yourself and you introduce your role in their community, that most of them, the vast majority, will inherently trust you and not question your motives.
Great. Thank you, Ed. Okay, this next one is from Matt. You emphasize simple messages repeated often. Yes, you got that. Yet many people feel the fatigue of too much information. What does the social science research say about this problem? And what is the best way to get a message to people who are already feeling overwhelmed?
Yeah, unfortunately, well, the research is really clear about this point. The only way to succeed is through message repetition. And the more information fatigued people are, the more that is true, because the less attention they're going to be paying to you. And therefore, the harder you have to try to make sure that they do understand what you're trying, the important information you're trying to share with them. So if any of you are not watchers of Fox News, I would actually encourage you to spend a little bit of time watching Fox News and watch the incredible message repetition that you will see every night of the week on virtually any show on Fox Network. And it isn't an accident why that happens. Because those commentators are absolutely convinced that that is the way they get through, and they put a lot of emotion into it, by the way. So they're not just droning on in a calm, unaffected voice, but they're getting very emotional about what they say, and as they say it over and over and over again. And I recognize the irony in this. It just is creating that polluted information environment in which we all live, but it is the only way to break through in this hyper-crowded information environment.
Yeah, absolutely something, we're all dealing with, not just in the climate and health space. So yeah, thank you. And Matt, I'll just add as well that a feature webinar in this series called Ally Acquisition is going to be talking a little bit more about that, and the need to just really understand the people you're talking to, and make sure that you are reaching them and breaking through with those messages. Great. And another one from Antonia. You discussed what people are most familiar with, or the health climate impacts that people are most familiar with. Have you ever surveyed what health impacts people find most scary and thus perhaps most motivating them to take action?
Yeah, we have. And if you want to read the peer-reviewed version of that, just Google my last name and the journal name GeoHealth. My colleague, John Kocher, was actually the first author on the article, but I am an author, so you can either Google John Kocher and GeoHealth or Ed Maybach GeoHealth, and you'll find the article in which we used the National Climate Assessment's Climate and Health Report from 2016 as the starting place to answer this question that Antonia has put to me. And in the 2016 Climate and Health Report, it broke down the health impacts of climate change into essentially 8 categories. And what we did is we wrote about 140, 150 word explanation of each of those 8 categories of health impacts of climate change. And for each of the explanations, we broke it into 3 pieces. What's happening in our climate? How is that harming our health? And who is most likely to have their health harmed in each of those 8 categories of impacts. And what we were really most interested in learning was since we do have limited opportunities to get in front of audiences and share what we know, as I've already said, we want to share the information that has the most value to members of our audience. So what we learned from that piece of research, we learned, for example, that the heat effects from extreme heat events, people are most aware of that. They're most aware of the effects of air pollution, and they are much less aware of vector-borne diseases, essentially outbreaks due to water and foodborne disease, and particularly relevant to another question that we haven't gotten to yet, but they're particularly not aware of the mental health impacts of climate change. And so we had people rate this information in terms of how novel it was, how new it was to them, how useful they found it to be in terms of helping them understand the health impacts on climate change, and essentially whether or not they would, how likely they are to share it with other people they know. Keeping in mind what I said earlier, that real success from a public health communication campaign comes from when members of our target audience share our messaging with other members of the target audience. So from that, we really identified of these 8 categories, well, all of them are about important categories to talk about. But if you read that article, you'll see specifically which categories we think have most value in a general US population. We did not have the latitude to do this kind of study at, in individual states or individual communities.
Great. Thank you for sharing more about that research, Ed. John asks, any recommendations with how to do the audience research to determine what is most important to them? So a little more about how somebody might do their own audience research.
Yeah, so I guess I would suggest start with the messaging that's in the Climate and Health Alert report that's on my homepage right now. You'll find in there not only top line messages, but you'll find those 850-word essays that I mentioned a moment ago that we've tested. Look at the findings in the GeoHealth article, and then just use your best judgment about what information you think will have the most value to members of your people in your community. And then, I actually am not a big fan of focus groups anymore, so I wouldn't recommend you run focus groups, but I am a huge fan of individual interviews. So bring in 10 or 20 people from your community, or send a member of your team out to a local library and engage with 20 people and show them essentially the information that you're considering sharing more broadly with members of your community, and find out from them which information they tell you has most value. If you were to conduct 20 brief interviews, that's a whole lot better than doing nothing. If you could do a larger, more systematic study, all the better. But it's that kind of qualitative response to the information that you're considering sharing that I think will be of greatest value to you in finalizing from a broader set of messages, a broader set of things you know to be true, which ones you're going to put your trusted voice most prominently behind.
Okay, these are great questions, everybody. Thank you so much. So I'm going to pull one more so we can wrap up on time. This comes from Laura. Do you have any advice about the balance between a message of hope/agency versus a message of urgency / seriousness?
Yeah, I do. Although I'm going to feel totally inadequate in giving this answer, because I wish I had a set of evidence-based actions that individuals and communities can take, because that's, being very specific is very much more helpful than being general. So I've forgotten who asked that question earlier, but that was the right question to ask. Laura, to your point, the evidence is pretty darn clear that urgency and seriousness messages are helpful, but they are more helpful in the context of ending on hope and agency messages. We need to give people actions they can take, because if we simply raise their sense of fear or anxiety, there's a real possibility that we just drive them away from us, that because we haven't been helpful, they would rather not think about what we've shared with them in the first place. So I personally would be completely comfortable with you leading with the hope and agency, and I have great news to share with you kinds of messaging, and then following up by supporting that messaging with the reason why those actions, the many reasons why those actions are so in the interest of individuals, families, and members, and your community at large. Because there really are so many good reasons to take these actions. Almost regardless of what action you're going to recommend, there are lots of good reasons to recommend it. Again, coming back to just to repeat something I said earlier, when I am conducting in-depth face-to-face interviews with members of the dismissive segment, I find that they and I often agree on many of the recommended actions, but we see different value in them. So many members of the dismissive community will tell me they completely accept recommendations that I am making, but not for the reasons I'm making them. And that's okay with me. I don't care what their reason for finding the recommended action to be important. I'm just interested in them considering the recommended action and hopefully taking it.
All right. Great, memorable point to end on. All right. Thank you all so much for joining us today. Ed, if you could just bump to the next slide and we'll share about what's next. Oh, it may be stuck. All right. So thank you all again. We just kindly ask that you please take a couple minutes to respond to a very short questionnaire that you will be getting via email in the next couple of days. Your feedback is really important to us. We want to make sure these webinars are meeting your needs, and we'll do what we can to use your feedback and improve. So our next event in the series is going to be in late February. It's going to be on social media best practices. And of course, tailored again, this whole series is to the topic of health effects of the changing climate. So we hope you will join us and keep an eye out for those reminders. And again, I just want to thank Dr. Ed Maybach for joining us and giving us a lot of great things to think about today. So thank you, everybody. Take care.